Steph, thank you and good morning. Earlier this year, pharmacists were granted expanded scope to assess and prescribe for 13 minor ailments in Ontario, including cold sores, pink eye, and UTIs. There's a new local place to get health care, your Shoppers Drug Mart. Joining us now is pharmacist owner and professional John Papastergiou to explain why this is so important for Ontarians and their access to care. John, welcome.
Yeah, thanks for having me.
So let's talk about what minor ailments are. And first of all, I'm so glad we're talking about this because I find that pharmacists are so underutilized given how much information they have. So let's really break it down. What is a minor ailment?
You know, minor ailments are those conditions that are generally very self-limiting. They're not serious. There's no underlying more serious issue. And to diagnose them is generally simple if you have some training. So it's those things like skin rashes, pink eye, urinary tract infections, things that if you don't do much, they'll generally go away on their own. But if you want to get relief quicker, we're there.
So all 13, do you want to go all 13 or should I do it?
Yeah, go.
All right, I'm going to play the role of pharmacist here for a second. You can now walk into a pharmacy and have the following taken care of: UTI, cold sore, allergies, pink eye, heartburn/acid reflux, hemorrhoids, tick bites, skin rash, oral fungal infection, premenstrual and period cramps, skin infection, insect bites and itch, muscle aches and pains. John, I mean, prior to this moment, how many people would walk into your pharmacies, because you have a couple here in town, and say, look, I need help now, and you have to say to people, I can't, I'm sorry.
You know what the challenge is? These are very, very common conditions. They happen all the time. They tend to happen more often evenings, weekends, after hours, when you can't get in to see your doctor very easily, right? Or you don't have the time to do it. So right now, we've had patients coming in historically, and you know, we had some over-the-counter options, but they're not always the best. Now we have the ability to come in, speak to your pharmacist, get assessed, and we can write that prescription for you, similar to what your physician would do, but you get it done a lot quicker.
Yeah, and I think, you know, no one disputes that the healthcare system is in complete overload. It can be difficult to get into a doctor to get, frankly, a prescription or a diagnosis that many of us either know we probably have because we've experienced before, and are just looking for confirmation and that prescription. So let's talk about the bigger impact, the fact that there is the ability for you to prescribe some of these minor ailments.
So we've had experience now since January 1st, so we've been doing it for a while, and you know, the public feedback has been excellent. The traffic we're getting into our stores is very high, so the demand is there. We know there's gaps in care in the healthcare system right now. The pandemic really showcased what pharmacists could do. I mean, when, you know, urgent care clinics could kind of reduce their hours, it was tough to get in to see your physician. We were available. You could come in after hours. You didn't have to make an appointment. And I think we're building on that now. So it's a huge opportunity for patients to get treated and get access quicker.
How do the appointments work?
A couple of ways you could do it. We have the PC Health app. You can make an appointment, shoppersdrugmart.ca or .com. You can make an appointment, or you could drop in. A lot of times the pharmacists are available. They'll see you right away.
And really, the reality is although this is something you've been doing since January, you've always worked in collaboration with doctors.
Absolutely. It's not like we're working in a silo. First of all, we're doing an assessment. If we don't think the therapy is appropriate, we're going to send you away. We really take the time to try to figure out what's going on. If it's simple enough, we can manage it. We'll treat it. If not, we'll work with the local physicians and get you seen.
Go ahead.
No, I was just going to say, because the thing is, and I think this, again, completely underutilized, and we probably always had the ability to ask advice. You know, the prescription thing is different, but the fact that we can, you know, access advice from pharmacists is so important because it often just alleviates the stress in our mind, right?
Yeah, and we were always there. So you'd come in and we'd be able to answer the questions, but a lot of times we had our hands tied. We say, yeah, we've got this option for you. We know it's a simple UTI. We know we have antibiotics sitting back here, but we weren't able to give them to the patient. There was that sense of frustration. Well, I'm here now. I've got to go to the urgent care, walk-in clinic, ER, wait 4 hours to get that same script. So it's just we're able to do it and do it faster now.
John, it's great to see you. I know we've done this virtually. It's nice to have you in studio. You're a pleasant person. We've got all the info on the screen right now. You can scan the QR code over there on your screen to get you to the online booking site, or go to shoppersdrugmart.ca/minor illness. These are new options in the province of Ontario. Some people think this is long overdue. You got an issue, now's the time. John, have a good day.